Good evening, everyone. I'd like to welcome to our final webinar of the current series. My name is Conor Dobson, and I'm a Teagasc Advisor in Drystock Advisor in Longford, and I'm going to be your host for the evening. We have two colleagues joining me, John Kelly and James Kelly. James is a Drystock Advisor in the Roscommon office, and he's going to talk to us tonight about lamb mortality, reducing lamb mortality, and the issues around it. John will join us for the Q&A and handle the Q&A, which will probably take place at the end of both our speakers or whatever. We're also joined tonight then by Seamus Fagan, who is from the Regional Veterinary Lab in Athlone, and he will update us on current issues and give his presentation after James. So without further ado, we'll start the webinar, and I'd like to ask James to share his screen.
Okay, folks, you're welcome to the spring webinar here on lamb mortality. My name is James Kelly. I'm a Drystock Advisor based here in Roscommon. I deal primarily with sheep farms. So this is just a preview of reducing lamb mortality here before Seamus comes on. There'll be a lot of overlap between the two presentations. So we'll start anyway with the background. This year, it has a major effect. Lamb mortality, major effect on the profitability in any sheep farm, but particularly this year with the way sheep prices have gone over the year. Losing lambs now is not, it's become a costly thing to be losing them. So approximately 50% of the lambs die in the first 24 hours. Now, most of you tuned in on this webinar, you're all sheep farmers. You all are familiar with lamb and ewes, and you all know that that first 24 hours for the newborn lamb is vital. So, in terms of lamb mortality, what are we targeting? We're targeting lamb mortality of less than 12%. So, we look at where we are today. Most flocks in Roscommon Longford at the moment are scanned, and a good average scan there will be 1.8 lambs per ewe. Most people mid-season lambing in the month of March there, so the ewes are gone 120 days in lamb now. You're talking lambing in the next 3 weeks, so we're at that middle point. We're there between scanning and lambing at the moment. Then that figure goes on to weaning of 1.6. These are the targets. So ewes being scanned 1.8. We lamb them in March. We wean them at 1.6. Aiming to keep mortality below 12%. And if this figure of 1.6 lambs per ewe can be achieved, with the price of lambs out there, a sheep enterprise can be very profitable if these targets can be met. So mortality is one of the key. Lamb mortality is one of the key issues affecting profitability on sheep enterprises. So if we look at the causes of lamb mortality here on this slide, what are the causes of lamb mortality? Hygiene being the main one there. Dichosia is another one there. Big issue with lamb mortality. Poor hygiene around the yards, infection, scoury, navel ill, watery mouth, etc. One of the main issues why lambs are dying around the farm around the lambing period. And dichosia also, in terms of oversized lambs, farmers not knowing their scanning date, farmers not scanning. There's still only about 70% of farmers out there. There's a 30% block of farmers not scanning ewes yet. And really, it's a shame because it's a relatively cheap technology, but yet it really is giving you that information to target your feeding towards where you need it. Like you're obviously you're feeding ewes that really need it at a time. So what can we do to reduce the losses? So this presentation, we're going to focus on two key areas. One being pre-lambing management. This is in the next month, say, before we lamb the ewes. So it's really what we're going to do in the next 3 to 4 weeks. And the second part of this, we're going to look at hygiene actually when the ewes are lambing. So pre-lambing management, what are we looking for here? We're looking to get a ewe to lamb down with 2 good size lambs or 3 good size lambs, whatever she has, an appropriate size of lamb. We're looking at for her to lamb down in body condition score 3.5, so that she's able to go off and rear the lambs, have enough milk for them for the first 6 to 10 weeks of their lives out on grass, and also have adequate colostrum at the time that she lambs. So 3 targets there are body condition score of 3, have a good birth weight of lambs, and have adequate colostrum. So scanning there, as I mentioned, is a key technology. You're obviously going to group. You're going to feed the ewes according to group scan, according to litter size. With triplets obviously getting the most, singles a little, singles less. Say 4 weeks out from lambing, you're just going to feed singles. Now, on the point of singles, a lot of farmers will say, should I feed singles? Do they need feeding? But if you are scanning at 1.8, you will need single ewes to cross foster triplet lambs onto. So we do recommend that those ewes get meal for 4 weeks pre-lambing, just to boost colostrum, just so that they're able to foster on a lamb onto them. So the quantity and quality of the feed is essential. So the diet is made up predominantly of silage and meal. So the quality of your silage is going to influence how much meal you're going to feed and how much of a duration you're going to feed, how long of a duration you're going to have to feed it for. So having silage tested is a key parameter for any sheep farmer there. It lets him know. It lets him know what he has. If he has poor quality silage, he's going to have a feed more and adjust accordingly. In terms of feed management, 600 mils at the trough. Sheep are getting big. When you start feeding them 7 weeks out, that same trough space isn't sufficient 3 weeks out. They'll get big. The ewes will get big as the pregnancy goes on. So it's about having 600 mils clear at each trough for ewes. So loads of trough space, good general feed management, no pushing, no shoving, no hurts, etc. I put in vaccines here as well. Critically important, the 10-in-1 vaccine. Recommended 4 to 6 weeks out. You're saying 4 weeks out to avoid hurts. Again, handling the sheep when you're vaccinating them, very important. Going easy on the sheep. Keeping it nice and tight. Keeping them nice and tight in the pen so that there's no jumping when you do administer the vaccine to them. But the 10-in-1, it is essential 4 to 10 weeks out for a sheep, or 4 to 6 weeks out for a sheep lambing. So birth weights. We have the targets here: singles 6 kilos, twins 5 kilos, triplets 4 kilos. Once a lamb, we'll start with the single there first. Like once a lamb starts going over 6 kilos, once he goes into 7, 8 kilos, you haven't bothered getting him out of the O. When he gets out after a heavy pull, there's problems. So again, going back to the scanning, if the O is fed accordingly, she should, these within reason, the lamb should come out at this level: 6 kilos, 5 kilos, and 4 kilos for the triplets. Survival rates, once a lamb goes below 3.5 kilos to 3 kilos, that small triplet, you all know you have them. You might have 2 big ones, 1 small one, or she might have them very small if she just wasn't scanned like. But once you go below 3 kilos, survival rates drop dramatically. So we're looking at them where it's 5 kilo lamb and a single or triplet, 1 kilo either side. Thereafter, we're looking for adequate colostrum off the O. In terms of colostrum, we'll be coming on to that in a few minutes, but we are looking at 50 mils per kilo of birth weight, live weight. So if a lamb being 5 kilos, we're looking at 250 mils of colostrum there for the lamb, but we'll be coming on to that in a few moments. In terms of hygiene, lambing pins, very important. I put in that picture there. Is that pin good enough? You're looking at it there yourselves. We can take questions afterwards. My opinion, probably not. You're talking adequate straw, like in a lambing scenario. That for me now would not have enough depth of straw. In terms of lambing pins, you're talking having 10 pins per 100 ewes lambing. Okay, you're talking adequate straw. During the lambing period, you're trying to clean out the lambing pins after each ewe if possible, and a good coat of lime. Water there, very, very important for washing, very, very important for the ewe. You know, when the ewe lambs, she's after losing a lot of fluids to the lambing process. She's producing milk. She needs a clean, fresh supply of water. And in terms of hygiene as well, there we have navel ill and scour. Navel ill, if it gets into a farm, huge killer of lambs. The main two areas it gets in is the navel, and it also comes through the mouth. Like, it's rarely spoke about through the mouth, but you really need to be disinfecting the navels with iodine or the spray products. In terms of scour as well, hygiene as well, the more straw you have, the quicker you get the lambs out of the environment, the cleaner the environment is, the less of these issues you'll have. So the whole point of hygiene is to reduce the environmental challenge in a shed. If it's a dirty shed, the lambs are going to be challenged by it. So it's all about improving improving the hygiene of the shed, be it cleaning out the shed, liming, disinfectant, etc. Get them out. In terms of equipment, all this stuff should be on farm way before lambing starts. We're talking gloves, long sleeve gloves, iodine, lube there, ropes, etc. All should be on site beforehand. And while on site, we'll be talking about sterilisation. Sterilisation with Milton is recommended, to have a 3 bucket system there. Have them one with Milton in it, dip them into it, sterilise it, rinse them, and have them ready to go again with during the lambing period. If the stomach tube isn't washed and sterilised from one lamb to the other, infection can spread very, very quickly. So just on the point of infection spreading, feeding the newborn lamb, colostrum, feed them as soon as possible. When the lamb is born, the inside of his small intestine is open, and it's open to absorption of the immunoglobulins in the colostrum. Okay, so the sooner you can get it into him, the better. Ideally within the first hour. As I stated earlier, 50 mils per 1 kilo of body weight. So a 5 kilo lamb, 250 mils. Now, some of you on this call may say, what if she hasn't got? That's 500 mils for a twin bearing ewe. That's a half a litre of colostrum. Some ewes out there won't have it. So in an ideal scenario, the ewe will have this amount of colostrum. If she doesn't, you'll get colostrum from another ewe is your next alternative. There afterwards, you'll go on cow colostrum, and you'll go a third more because it just wouldn't be as strong as your colostrum. And then you're onto your artificial Volac, etc., your artificial products that you mix up. But the whole point of the colostrum here is to give passive immunity. You're trying to get this into the lamb to give the lamb passive immunity against navel ill, joint ill, scour, everything. The 3 points here on the colostrum is: 1, to give him passive immunity; 2 is to give him energy to get up and suck his yaw; and 3 is a laxative to get the small intestine moving as quick as possible. When the lamb is born, there's a coating of brown fat around the lungs. And once the lamb hits the ground, he starts to utilize that brown fat. So that will only last, that gives the lamb the initial kick to start going around the shed looking to suck for his mother. But in the event that he isn't, you'll follow these guidelines here of 50 mils per kg, and you'll go back to what I was saying there about mixing an alternative or cow colostrum if she hasn't got it. And the final slide I have here is farmers' health themselves. Like, we've, after giving a quick run through there on lamb mortality, we talked about the ewe, we talked about the lamb, but we didn't talk about the farmer at all. So really, on an 100 ewe flock, it's a 4 to 6 week period. Lamb and ewes, it's a very busy time, lot of night work, long hours. So if a farmer could be getting a little bit of rest round now before this period starts, all the better for him. In terms of transmissible diseases, a lot of the diseases in the lambing shed, be it abortion, Seamus will be looking at some of these, be it in zoonotic toxoplasmosis, a lot of them are transferable onto humans. So pregnant women in particular need to be very wary of going near these animals around lambing time. So we're here on the 10th of February. Most flocks will be lambing mid-March. Now is the time to prepare. Have your ewe fed, vaccinate her, have your lambing shed ready, get it cleaned up, get your materials all in place. Now is the time to be preparing for the next 3 to 4 weeks. Do a bit every evening, and hopefully it's a successful lambing and you're bringing mortality down under that 12% figure we mentioned. So we'll take questions at the end.
Okay, James, thanks very much. That's grand. If I could ask maybe Seamus to come in there.
Can you
Okay,
see that,
Seamus.
Conor?
Yeah, I can indeed there, Seamus. Yeah,
Grant.
you can work away.
Thanks very much for inviting me to talk here this evening. My talk is mainly on the Thin Ewe Scheme or Thin Ewe survey, which we carried out over the last few years. But quite happy at the end to take questions on anything that people want to bring up. So the aim or purpose of this was to see that it wasn't that if fella had thin ewes, it was for fellas who had thin ewes, sheep farmers who had thin ewes, that they thought there was too many of them on the farm when most of the normal everyday, that nutrition seemed to be good. Things like mastitis, lameness, etc., that lads are well aware of had been ruled out, and to see could we find out what. And a big part of this was driven by trying to get a handle on what level of iceberg diseases was out there. I'll get back to the iceberg diseases in a minute. What prompted this? One of the iceberg diseases, Medivisna, MVV, which is caused by a virus, was first diagnosed in a flock in Ireland, in 2 flocks in Ireland in 2020. And there was an industry stakeholder meeting, and we were wondering, question basically was, what kind of a program will we put in place? And 1 for Medivisna and 2 for the wider iceberg diseases. And the stakeholders considered it essential that we get an estimate of the iceberg disease and how much they were costing sheep farmers before they would think about putting their hands in their pockets, basically, to pay for a eradication program. It was modelled on a UK one, which was done a couple of years previously, and I suppose the results from that UK one was frightening enough, because half the flocks in the UK that were in the scheme that submitted sheep had an iceberg disease. The other thing we were trying to look at was the level of the parasitism, which, well, that's a fancy way of saying, it's chicken and egg with parasitism. Was parasitism driving some of these issues, or were some of these issues driving the parasitism? And it's often very hard to know which is driving which. And the other thing that I suppose I had a particular interest in is teeth problems. And when I talk about teeth problems in sheep, I'm more talking about back teeth than front teeth. Every sheep farmer is aware of front teeth and looking for aging sheep and looking for broken mouths, front teeth. But back teeth to me are a big, big problem, and one that's very much underdiagnosed. So this was run in conjunction with ourselves and Teagasc, and Teagasc advisors looked for farmers to submit, and we asked the farmers if they were taking part to bring 3 Thin Ewes to their nearest regional vet lab, and then we carried out postmortems on them and did a range of tests looking at the various diseases that we were looking for. So the reason for an iceberg disease is any iceberg is only about 1/10 of it shows above the water, and that's where these diseases, generally by the time you see these diseases on your farm, there's a lot of damage done, and a lot of the damage is in sheep that you still don't know are infected, and it's causing other problems, like I talked about, the parasitism, driving other driving up the infectious pressure on your farm and with other diseases, nor what we consider regular enough diseases, because these sheep are always some level of immune compromise as well. There's 5 main iceberg diseases. I'll go through them later on in a bit more detail what each of them is. So the findings from the survey, I suppose the 3 highlighted there in white, they're the three of the iceberg diseases, and you can see they came in around between 5 and 10% of flocks had one of them, which is not a huge percentage, but it's still plenty high enough for us to be worried that the potential for spread is definitely high. And the same if you're buying in sheep, you know, you can take it that you have a 1 in 10 chance of, if you're buying off someone else, you have a 1 in 10 chance of buying it in, because 1 in 10 of other flocks will have it. Just going back then, the teeth was a big one. And when I say teeth there again, I'm talking back teeth. And no surprise to sheep farmers that parasites, worms, was the biggest problem. And I suppose it's helpful, maybe I'll talk a bit more about worms later on, but just that this is not what I would call, you know, sheep farmers are well aware of worms. So this was worms undiagnosed, in the sense that a lot of these sheep had no worm egg count, or very low worm egg count maybe at the time. But when we looked at their lining of their guts, we could see the damage that had been done previously, maybe even when they were in their first season, when they're only 5 or 6 months old, done by parasites that had caused chronic long-term problems in these sheep. So I'm just going to talk about teeth first, back teeth, as I said. So these is jaws of a sheep. You can see tooth missing here, gaps, ridges on them, sharp ridges, uneven, you know, not nicely lined up. So this is the bottom jaw again, this sheep, and I'm looking here at the difference. So you can see one jaw is a lot bigger than the other. This is a similar kind of picture, except the jaw, it's the thickness is spread out over a longer distance. And the side of a jaw with a dirty abscess on it. When we cut into one of them jaws, this is what we see: big dirty tooth abscess, a lot of pus. And this is it just from another angle or a different tooth, but you can see. So I suppose the message here to me is, you know, probably most of us at some stage in our lives have had a toothache or even a tooth abscess. And we all know how painful it is and how quickly we'll go off form. Now, we only have to use our teeth for a half an hour, maybe an hour a day. Sheep, we're probably looking at her 8, 10, even up to 12 hours of trying to chew. And she's having to chew a lot more than us to grind up, chew the cud. And you can imagine if you have this in your mouth, you're not going to be too happy chewing the cud or trying to eat. So, you know, it's a huge driver to me of ill thrift in ewes. Just quickly going to, as James mentioned, you know, to me, I always put this slide up because I think it's very easy to focus on one area, but, you know, James talked about the environment, which in the lambing shed is keeping everything clean and healthy. The host is the animals themselves. He mentioned about good nutrition, that should be in good body condition. And then the microbiome, you know, is different bacteria, viruses, etc., that can cause the various things. Now, the way I kind of look at this is it's a 3-legged stool, and a little bit of work on each leg is far better than concentrating too much on any one leg. Because if you concentrate too much on one leg, you have one long leg and one short leg, you're not going to have a balanced stool. So often the best results you can get is doing a bit of work on all 3 rather than obsessing over one area. And then when I used to put up that slide, people always used to say to me, well, the most important thing is in the middle of the 3 things is people. No matter where you go, it's you know, and James mentioned that, you know, we're a month out from lambing. if you can just get into the habit of getting thinking about your lambing in time, going down to the shed, doing a little bit every second or third, every evening or whatever, putting small things in place, it'll really pay dividends to when you get busy. We're just going to go back to parasites now. And one of the things I think we can underestimate is how intelligent these worms are. It depends on how you define intelligence, but one way of defining intelligence is the ability for an organism to survive in its environment. And when you look at these, they've been around for 400 million years. We're only around a small fraction of that. One of them there, it survived for 46,000 years, recently found by people from UCD were involved in the research. The topsoil alone contains 60 billion nematodes for every human. So if you use that kind of definition of intelligence, it's their ability to survive, their ability to adapt, etc. That puts us in the halfpenny place. So I always think, it's at our cost that we underestimate, so we need to work with them and try and understand how they move and work, etc., rather than think we can bully them. I think for a long time we thought we could bully them, with the advent of anthelmintics 40, 50 years ago, and especially maybe the ivermectins. We thought we could bully these, but we're unfortunately finding out in the last 10, 15 years with anthelmintic resistance that they're coming back to bite us in a big way. So these are just a few pictures. So this is PLI. And this is just a video of when we open. This is the stomach. So you have the rumen, the big stomach in the back. So this is the abomasum, which is equivalent to our stomach. So that's homuncus. I think that video is fairly dramatic in the sense you can see how many of them are there. Unfortunately, this is the trend in the regional vet labs for the last few years about the number of deaths. And that was only, and 2024 would be, I haven't got the numbers up there, but they could probably be gone off the top of the screen. Homuncus, it's a nematode. We always consider that it probably, now we know it's been in Ireland a long time, but we considered the weather too cold and that it wasn't suitable and didn't cause disease. But for whatever reason, as the climate changed a bit, but probably the worm itself has adapted to our climate. And while it is probably more prominent in the southeast and the warmer, at this stage we've diagnosed it in sheep in every county in the country, from Donegal to Kerry to Wexford up to Louth, everywhere. So it's just, it's called the barber pole worm. And that's the reason for that is it looks, of the red and white stripes on a barber's pole, and that's actually the gut wrapped around the reproductive system in the female. So only the female will look like a barber pole. And when she's had she can suck in 0.5 ml of blood a day. So you can see how many worms was in that video. If they're each taking 0.5 ml a day from a sheep or a lamb, they're not long about causing serious damage. The other thing about it is they really lay very, very large numbers of eggs. So if you get a very high egg count back from your feces, egg counts, consider that homuncus could be on your farm. And the other problem around this part of the world is if you're down the southeast where they have very little fluke, you get a PLI, you'll get bottle jaw, oedema under the jaw, etc. It can look quite like fluke, and therefore, and we've seen it at, April, different times of the year. So it's just something to be aware of, that it is a potential alternative diagnosis to the signs of fluke now in this part of the world. The other thing is anthelmintic resistance. in parts of the world where they've had to stop farming sheep, it's generally due to Haemonchus, and that's because of this being able to lay so many eggs that allows it to develop resistance a lot quicker. So I'm just going to go on to, just before I finish on the parasites, I just want to re-emphasize that what we saw in some of these sheep, the fact that we got in the sheep very, very fresh, they were actually brought in alive and we put them down. We were able to do a really good examination of the intestines, which often we're not able to do when when lads submit a dead sheep to us. The intestines go off very quickly in any animal, but especially in sheep. And so we're not often able to do really good in-depth examination of the intestines. But because these sheep were so fresh, we could do really good analysis of the intestines. And as I said earlier, one of the things we found was, evidence of chronic damage. So just because you're getting a 0 egg count or whatever, one particular farm, like his ewes that he submitted, they were about 48 kilos. And they should have been mature weight, and they should have mature weight of about 70 kilos. But other than that, than when they were submitted, to look at them other than just the size, they look perfectly healthy. It probably seemed a shame to actually put them down. They look so healthy. But again, once we looked at their intestines, they didn't have high egg count, Ryan, weren't full of worms. But the damage was probably done when they were 5 or 6 months old. So it just shows how important it is that controlling parasites all along the life of the animal, because it can leave chronic damage there that will affect the ewe's reproduction cycle for the rest of her life. So just moving on to the iceberg diseases. In Ireland, these are the 5 iceberg diseases that we consider as the most common or potentially the biggest issues that we would have. So OPA, or ovine pulmonary adenocarcinoma, it's basically a tumor of the lung that's caused by a virus. And you get, the big thing is this excess fluid production. So basically the cancer causes a tumor, the tumor is a glandular structure, and that's producing excess fluid in the lung. The name Jagiecki comes from, it's a South African word, and it's driving sickness, because when they noticed it first, they'd often be driving sheep long distances. And as they were driving them, the ones that would be suffering from these diseases would just lie down and die as they were moving them. One of the things they talk about, this excess fluid production. So one of the things people talk about doing, but this only works when a sheep is probably on her last legs as well, is the wheelbarrow test, where they literally pick them up by the back legs and fluid will pour out of the nose onto the ground. This is just a picture of, so you can see all this fluid here. This ewe is dead, but you can see all the fluid that just ran out of her after she died. So this white is the tumor in the lung. This pink is the more normal lung. And this is just at a deeper level. So up on the top left, you have normal enough lung tissue. You can see the white is the air sacs, so plenty of room for air to be in that lung. Whereas down here, you have this glandular structure, and up here, and basically you can see how consolidated, and basically there's no room for air in that lung, plus all the excess fluid this glands are producing. So basically she can't breathe. Unfortunately, the virus leaves, the ewe mounts no immune challenge. So often when we're looking for a diagnostic test, sometimes we're looking for the virus itself, or other times we're looking for the body's response and if we're doing a blood test, often the body's response to the disease we're looking for. But there's no blood test available. So clinical signs is, usually weight loss, more thin ewes in your flock than you should have. PCR is another technology, but it's not really viable for picking up you know, when we do the PCR, we're doing it directly into the lung tissue. But if you do it down the nose or that, it's not just sensitive enough to pick up most of them. So the most definitive way, unfortunately, still is actually submitting, a ewes that die, and we do the post-mortem on them and do the PCR test and the histology. The histology is them slides you saw earlier of the deeper in the lung. So best way to control it, this applies to every one of them. The best way to control any of these is not to get it, and that's biosecurity. Biosecurity is stopping diseases coming in from the outside. Biocontainment is, what James was talking about, we'll say in the lambing shed. You'll have bugs always knocking around on your farm, and this is how to stop them spreading too much from one animal to another and keep infectious pressure down. It's very hard to get rid of it. Some farmers have had to depopulate, restock, etc., cull aggressively in low body condition, respiratory signs. This is recommended, but obviously depending on your farm size, etc. If you're a very big sheep farmer, maybe keeping different management in each group, you have different age sheep, but that's not very practical maybe on smaller farms. Reducing close contact, again, more trough space, etc., etc. And some people, this ultrasound scanning, they do some of it in Scotland, and that we've done it in a few flocks in Ireland. It can help. It's fairly crude in the sense it picks up the tumours in the lungs, but it doesn't know whether they're tumours. They could be there for some other reason. But if it's picking up something, that sheep needs to be culled anyway, because it's probably a lung abscess or something. Iona's disease, I'm not going to spend too long on the rest of these. I prefer to leave time at the end for questions. These slides are all up on the Teagasc website anyway, so if people want to go back over them, they'll find them. I'm sure the lads can send on the link at the end. I suppose Iona's, most of you are familiar with cattle to some degree, and Iona's, a lot of people talk about scour in Iona's, and in sheep, scour is not a common feature. So weight loss and infertility. So that's just because the sheep are not scouring, you can't rule out Iona's in your flock. So basically what happens in Iona's, so this is the intestine, and it just gets what we call corrugated, and thickened. So basically the ewe starves to death because she can't absorb the nutrients through her intestine. It just basically gets thicker and thicker, and she can't absorb the goodness out of food. So she's starving to death even though there's any amount of food in front of her, and she's eating and everything else. Again, not going to spend, any of these diseases, if you think you have them, the first step is to try and get help, get them diagnosed. And after that, then your Teagasc advisor, your vet, ourselves here, there's plenty of advice out there. And if you have one, you probably need to get help, and there is plenty of help to work on it. CLA, this is a bacterial one, and it causes abscesses often in the lymph nodes around the head. Probably a bigger problem in pedigree flocks for some reason often than commercial flocks. Usually gets in maybe through, again, bought in, but once it gets in, things like shearing or, equipment that's used around the farm can spread it quite quickly, or even, certain places where ewes go to scratch regularly or things like that can help to spread it. Again, control, you're talking, there is a blood sample link that can help, test, see whether ewes are infected or not. But again, the problem with all these iceberg diseases, they're hard to eradicate, they're hard to find in your flock, and a lot of them, there's no cure in them. So border disease is very similar to BVD. We don't see much of it, thankfully. The last time we did a survey of sheep flocks in Ireland, I think it was 0.4% of flocks were positive, which is quite low. But we've had a couple of big outbreaks in sheep flocks in the Sligo RVL that that end of the country. So it is about, and it's just something to be aware of. If it wouldn't have shown up in the Thin Ewe survey because really it's at birth and abortions and that kind of thing. So obviously we weren't getting in young lambs or whatever. So a video would probably be here, but a kind of hairy lamb that has a tremor, so that's why the name hairy shaker comes from. So that's it. But again, it can, if you've excess mortality in newborn lambs or abortions or that, it's one of the things we just, you need to get checked out is border disease causing it. And Medivisna, the one that started this, it's a virus again, and it causes, potentially, it can affect the lungs, it can affect mastitis, or it can also affect the brain and cause neurological signs. We're reasonably happy that it's probably hasn't spread especially among the meat sheep flocks in Ireland. The flocks we saw it in mainly, now we did see it in one or two meat sheep, pedigree flocks, but they have been depopulated. It was in Northern Ireland for a while, and they seem to have done a fairly good job on controlling it as well. But that doesn't mean we don't have to be very aware of it, because it is quite amount of it in the UK, where they would have similar enough systems to us. So nobody really knows, but touch wood, that why we haven't had it, but hopefully that's the way it'll remain. Again, there's no curing, so you're talking depopulation, trying to cull thin ewes very quick, artificially rearing lambs so that they don't get it off the dam. So just to conclude, so worms and teeth were the biggest culprits, which is, especially back teeth, I suppose. I'm not sure if you can see, but the easiest way, so it's very hard to look at back teeth in live sheep. The easiest way is probably from the outside is to rub your hand along the two bottom jaws that I'm kind of doing here, and just see if they're the same size, or if you do it regularly, you'll have an idea what the size should be. Because when I say you compare one with the other, and if there's a difference, of course, only a week ago I had a sheep in and she had both of them, and she had massive abscesses on both jaws. And also along the top, you can rub your fingers along the top and see if the one side looks the same, or you're seeing any bumps, or you're feeling kind of sharp edges on the teeth, even through the gums, etc. Of course, you're also looking at maybe she's throwing up the cud a bit, or a lot of drool from her, all things that could indicate potential back teeth problems. And to me, there's no curing of it. So she's, you mark her for culling as soon as possible, because she'll become a source of lots of other diseases for you. I suppose anything with sheep, to me, one cycle drives another. So James mentioned about good body condition score coming into lambing. So UVO with some of these problems, she's going to be in poor body condition coming to lambing. She's going to have poor quality colostrum. She's probably going to have small, weak lambs. So her lambs now become the drivers for disease. They're going to multiply E. coli in the first day or two of life and help infect other lambs. After a week, they're going to be the multipliers of things like crypto. After a month, they're driving the coccidia cycle. After 3 months, they're driving the nematodirus cycle. After 5-6 months, they're driving the other stomach worm cycles, plus any other diseases. So to me, that's why culling thin ewes in time, if you're happy they're not responding, to me, you give them a body condition scoring. To me, is a key part of sheep farming. And, excellent flock health, it requires attention at an individual level. And to me, that's one of the main things you have to get into your head. So going through your sheep regularly, if possible. Even James talked about, you have them penned up maybe a month ago or whatever. Walk through them regularly, and if a sheep needs to be moved to another pen, just move her. If she needs, for whatever reason, put her hand on her back, she's not where she should be, move her into the triplets or whatever, up a pen as we call it, just to get a bit more. Because if you don't, she then will just start this cycle of infectious pressure that just goes on and on and on. So that to me is one of them, why putting your hand on the back of your sheep regularly is just such a key thing. And it doesn't have to be too complicated, in the sense that if you're just figuring out which ones. And so when I say cull them as quick as possible, most times you're talking at the end of the lambing cycle when they've been weaned, pull out your thin ones, start giving them a bit of extra something, whether it's on the better grass or whatever. But if after a month you think some of them aren't responding, you need to figure out why. And if you can't, you need to get rid of them. It's my probably key message tonight. So thanks very much. Yeah, I'd especially like to thank the farmers who submitted them, because unfortunately we couldn't get a budget to pay for them sheep. So the people who submitted them, the farmers, they were at the loss of the cull price of them sheep. So really appreciate anyone that submitted to us. Thanks very much.
Thanks, Seamus, for your presentation or whatever. If James is there, and John, maybe I'd ask John, see is there any questions in the chat box for either of the two speakers?
Thanks, Conor. I have a number of questions here on the Q&A for James and Seamus. I might start with James. James, for ewes that are on the fat side already, is it too late to restrict them, or what would your advice be pre-lambing?
Yeah, you wouldn't go restricting them, or you'd bring more bother along on yourself. You'd probably leave them on forage till around a week. It would depend on what their litter size is as well. There'd be a range of factors there. Like if they have twin lambs, okay, it's actually a good position, yours on the fat side. It's a good position that they'll be able to milk that off their back. They mightn't need as much meal. Not really in intensive sheep systems, as Seamus there will allude to, it's not really a common problem. But again, going back to body condition scoring them, group them, they just won't need as much meal as yours, say, on the 2.5, 3 body condition score side. I wouldn't be overly restricting them, but definitely you could reduce the duration of time you'd be feeding them and the level of meal, but you wouldn't be going too hard. You wouldn't be going too extreme on it.
Okay, and also for sheep that are lambing on 15th of March, should they start feeding now or should they wait?
Again, scanning, critical tool there for any sheep farmer. Knowing the litter size is critical. If you do know the litter size, you're talking the 10th of March, you're talking 4 or 5 weeks out from lambing. Definitely, you'd be in the area assuming silage, most silage being from 68 to 70 on sheep farm. Sheep farms have a tendency to make good silage in the May for yours. So you would be talking about feeding them yours, starting them off at 300, bringing them up to 700 pre-lambing. Now, once you go over half a kilo in one feed, ideally you should be splitting the feed. Now, if you build it up gradually, you can get up to 0.5 of a kilo, 0.6 of a kilo in one feed. You can get away with it. But once you're getting into 0.7, 0.8 in an ideal scenario, you would be splitting the feed morning and evening. So depending on condition of the ewes, depending on quality of the silage, all cases being equal, the ewe being in a body condition score 3 and the condition of the silage being good, yes, you would be starting at around 3 to 500 grams at this stage.
Another one there, James. What percentage protein should be in the ration?
Well, most rations are sold on a crude protein level and are sold between 18% to 20%. There's a lot of common perception out there that the higher the crude protein, the better the ration is. Really, it's down to the ingredients in the ration. It's really down to predominantly the soybean meal content. In an ideal world, if you could get a ration with 20% soybean meal, that would mean 200 grams of soya on every kilo. And if you was eating the week before lambing, if you was eating 0.8 of a kilo to 1 kilo, say in the week before lambing, she'd be taking in, if she's eating that range of a kilo, say, for roundness, you're saying she's bringing in 200 grams of soya. That passes the rumen, undigested, goes into the small intestine. It's a higher quality protein. It's taken in there. The 200 grams of soybean, then the protein in it will be cut more or less in half, 100 grams per each lamb. So a good rule of thumb would be a 20% soybean ration, if possible, to a twin bearing ewe, and that would mean 100 grams of soya per lamb per day in an ideal scenario.
Thanks, James. Just other questions now, moving on to practical management, I suppose, at housing. There's a question here. Is it advisable to shear ewes at housing, and can that improve, or has it a negative impact on lamb mortality?
Well, again, every farm will vary, and every farmer has a different system. The main thing is, ideally, you should have 2 months wool on them, letting them out, because when you do let a ewe out, say on the 17th of March, Irish conditions being cold, wet, windy, you do need a 2 months coat of wool on the sheep to let her out. In terms of management, yes, the lamb will get it. The lamb will get it easier to suck the ewe. Do you know what I mean, John? The lamb will find the teat easier. You'll have better birth weights as well. A sheared ewe will tend to have higher intake. She'll eat more silage, eat more meal. Your targets there of 6 kilos for the singles, 5 for the twins, and 4 for the triplets. You'll achieve them easier because she'll have higher intake. So if shedding is available and it suits the system of farming that's on, if it suits the system that's the sheep enterprise that's present there, yeah, shearing would be advisable. Again, shed space as well is another thing. Some people do it, you'll fit 20% more sheep in the shed once they are sheared. So every farm is going to vary, but there will be no harm in doing it in an intensive system with yours going in, say, after Christmas.
Thanks, James. There's another question here. Many farms lose a lot of lambs 3 weeks after lambing. What are the reasons for this? This from South Roscommon sheep farmers on the comment.
Yeah, we didn't come on to that now. We really only dealt with getting the lambs on the ground and getting them fed. We didn't really worry about them 3 weeks later.
No.
I suppose, John, a lot of farmers, they're feeding ewes. How do you reduce it? A lot of farmers feed ewes for 7 weeks pre-lambing, and then they go cold turkey. They let them out, and they go cold turkey. They'll let sheep out on grass, and next thing, stop feeding the ewe meal. The ewe kind of melts, milk yield goes down. So I suppose to reduce mortality out in the field 3 to 4 weeks later, you'd continue feeding the ewes. Now, you wouldn't be feeding them at a high rate, but you continue feeding the ewes meal. You'd try and give them a good supply of grass. You'd be picking sheltered fields as well for younger lambs. Like shelter is a huge thing there. Like you'd be picking hedgerows, walls where lambs can get a little bit of shelter from. Keep the ewe fed, a little bit of meal to keep her moving, so to keep the milk yield up. And again, good grass. But a lot of them lambs that are lost, John, are lost due to starvation or literally lack of milk. And again, it goes back to managing your ewe. And the second thing then will be joint ill, navel ill, or scours out the field as well. So the work just doesn't stop when the ewe is lamb. Like, you still have to keep an eye on herding these fields in an ideal scenario twice a day, going around looking at lambs, looking at ewes, etc.
Yeah, and I suppose that's something too, Seamus, that you probably see a lot as well. I'd say maybe you could comment on that. Maybe would you have a lot of lambs coming into the lab, sudden deaths or that at a young age?
Yeah, I suppose as James alluded to, to me, I always split lamb losses into either infectious or non-infectious causes. So as James said, A non-infectious cause for a lamb is usually, just not enough nutrition. And often that's things like the ewe gets a bit of mastitis and the lamb stops sucking, or she won't let him suck, or especially if there's the other thing we'd regularly see is maybe there's twins or triplets. Well, twins, and next thing, when you do the postmortem, you say, look, that unfortunately looked like there was nothing in the lamb, that it was hunger that killed it. Often when the farmer goes back and checks that then one of the teats had gone, and only one lamb was getting decent amount of milk. From an infectious point of view, James said, your 8-in-1, 10-in-1 vaccine. If that's not done, that age group, you'll often, because the maternal immunity is low, that's passed on to the lambs, so it'll be wearing out the lambs. So the clostridial diseases can be a cause at that age. Coccidia is often kicking in at that age as well. They're probably the big ones from the infectious side of it.
Seamus, I might move on. Thanks, James. Might ask, we have a number of questions here, Seamus. I want to ask you, conscious of time as well. Barber's pole worm. How can you identify it? Is it only on a post-mortem, or can a fecal egg count test help?
Well, as I said, the fecal egg count tests can help by, if you see a very, very high egg count, it's a good indication you have Barber's pole on your farm. The other thing is, seeing lambs or sheep, and unfortunately, a couple of farmers, I think last year at the National Sheep Conference, we had a farmer presented on it, and he'd seen big losses suddenly in both sheep and lambs. So that's a problem with it as well. Adult ewes can be affected as much as lambs. They don't develop immunity like they do to the other worms. They're not near as long lasting. As I said, the pale eye, is probably the biggest indicator. Like in countries where this is an issue, they have it's called FAMACH, a FAMACA test, where it's basically looking at the color of the eye to try and diagnose how much Barber pole is affecting your sheep. Because the loss of blood is the critical thing here.
Another one here, Seamus. It's a comment and it's a question at the same time, that these diseases that you mentioned this evening are very hard to identify. Is there a case for more observation of cull ewes slaughtered in the meat factories by the Department of Agriculture or the vets there, to maybe give more feedback to a farmer if they're sending their cull ewes into a factory? Maybe something like on the beef side, health check report or things like that.
Yeah, I would definitely think there can be, but it's not as simple, Now, like we did go into Kildare Chilling about 6 or 7 years ago to do a study from OPA, but there's so many things affect that it's one, identifying that there's something wrong with the lungs. It's a whole other step then to identifying, just we'll say, whether it's OPA or not OPA. So in that case, what we did was we had to go in, we checked, I think it was about 2,000 sheep. And any of the lungs that were infected then, any lung that didn't look normal, we threw them into a bin and we brought them and looked at them then in the lab and carried out, PCR and histology on them to see what was in it. So there's a lot of work in getting really accurate feedback on these things. But I do agree with the principle that, no more than the liver fluke or whatever, like in sheep, in cattle, that giving farmers feedback on what, if there's condemnations in the factory, a rough, was it the lungs, was it the liver, and if some estimation can be made, but often it's quite hard to make an estimation. Yeah, it's the lungs, but what caused that lung problem, I suppose, is not that simple. If you look at a factory, the speed of the line, etc., on a sheep line, you don't have that much time to examine a lung to give, it's kind of if in doubt, get out. Do you know what I mean?
Yeah.
But that doesn't mean the thing can't be improved, and and there should, to me, better feedback definitely would be helpful to sheep farmers.
Another question here, Seamus, and I think it's a very important one as well for people practically, is how soon after death do you need the animal to conduct an accurate post-mortem? So I suppose basically, do they go off? Is there a time
they do.
limit?
I suppose it's the two things, the message we try to give farmers and vets and ag students and the fresher the animal and the better the history, the better chance we have of getting a good result for you. So, and again, it depends, like even things like time of the year, obviously, the warmer the weather, she'll go off quicker, the heavier the fleece, she'll go off quicker, the more meal she's eaten, the quicker they go off. But things like OPA, are probably, some things are easier to diagnose in, and we'll say, a sheep that's gone off than other things. The parasitism, like the guts go off really, really, the intestines really quick. So getting a good handle on things like parasites, we can still get an egg count for you, but really doing good examination of the intestines is quite hard to do, unless the animal is very, very fresh. But as I say, look, just as a rule of thumb, and it's not within everyone's remit, but in a sheep, especially if she's a well-fed sheep and it's anywhere warm weather, like you're probably talking much more than 24 hours. Certainly after 48 hours, she's probably not going
Probably
to.
too late.
Yeah,
Within the first 24 hours. Yeah.
if
And I suppose,
possible. Yeah.
at lambing time, a lot of these problems occur, and unfortunately, farmers are under a lot of pressure, I'd imagine. So, maybe Seamus, could you
Yeah,
tell us
just
the process for bringing an animal into the regional veterinary lab? Can a farmer contact you direct, or do they have to go to their vet? Or
you have to go through your vet, and look, we recognize, the issues, that look, in the middle of the lambing, it's hard enough to look after the live ones, don't mind the dead ones, and unfortunately that's the
yeah,
reality for a lot. And then it's the distance as well, how far they have to come. But the process is, it has to be booked in through your vet. So that just means, if you want to submit, like it's normally just pick up the phone to your vet, he rings us, he gives us some of the details, and then we'll contact, usually get the mobile number of the farmer and we contact the farmer, or, but we're open, from 9 o'clock. So even if you can't, we're not going to turn anyone away if they need to get here at 9 o'clock and they can't get through before that or whatever. But if they rang their vet may not have made contact at that stage. But it will have to be go through your vet at some stage in that sense, because we'll always send the results back to the vet rather than the farmer. That's just the way the rules are set down for us. But there are reasons for that as well, because it's about interpreting the results, and the farmer, local vet should know a good bit more about the farm and the conditions. And James talked about that. These things have always so many variables that's why the results are fed back through the local vet.
Seamus, another one here, and I suppose a more practical one that sheep farmers are seeing. Are we confusing CLA, the casus lymphocytosis, with dosing gun injuries?
I wouldn't think so. Dosing gun injuries are inside. They're usually quite dirty and they act quite quickly. My experience, it's usually within 3 or 4 days you start to see deaths, maybe quicker if there's a lot of damage, but you'll usually see zero from the outside. Maybe sometimes if they live for a week, 10 days, you start to see the swelling under the jaw here and that, but I don't really think it's that easy to confuse the two.
Okay. Thanks, Seamus. There's just another question here, maybe for either yourself or James. How long before lambing should I give the 10-in-1 vaccine, or the 8-in-1? So the clostridial vaccine. What's the optimum period, I suppose, before lambing to give that vaccine to the ewes?
Yeah, I think James said there, again, it depends on, the first time you're given it, they should get 2 shots. But a lot of lads will do that with their hoggets before they go and lamb. But so they're only talking a booster then each year. And most people would say somewhere between 4 and 6 weeks pre-lambing is probably the ideal period. What do you think of that? Obviously, if you have to give the 2 shots, you need to start earlier so you can give the second shot maybe about 4 weeks before lambing. Because like James said, to avoid handling heavily pregnant ewes. But you also need to give the vaccine a little time to work so that the antibodies show up in the colostrum. So I would say, dependent, a minimum of 4 weeks. Whether the last shot needs to be a minimum of 4 weeks. If it's only one shot, you're given somewhere between 4 and 6 weeks. If you're given the 2 shots, you need to work back, look at after the 4 week interval, then you'll be given it at 8, 9 weeks out, 4 or 5 weeks out.
Okay. Thanks very much, Seamus. There's just one more question there, and it's probably more for James. Should you apply nitrogen now in order to have grass in March, or is it too early? So that's a more practical question, I suppose, on the ground. I suppose how we
Yeah,
feed
well,
these ewes and lambs.
every year, John, is going to vary. Just soil temperatures haven't just come up yet good enough for urea, but you would be talking about going the 3rd week in February. Around this locality, a lot of farmers will go with a half bag of urea on the whole farm, on the grazing area, just to give that ground a bit of a kick. But just at the moment, with the dry month in January, low temperatures, you'll know from driving around the country that fields are kind of brown at the minute. We haven't had a lot of rain. They're not that lush green at the minute. Ground is trafficable. It's dry enough for chemical nitrogen at the moment, but I would be inclined to hold off another 2 weeks before going with it, just to let the temperatures come up a little bit more, like. But in terms of, maybe 2 more weeks to let the temperatures come up a little bit more for best results. But yeah, definitely it will give those fields that were closed up last October, November, it will give them the kick of this early spring grass that it's invaluable for the ewe once she goes out with the 2 lambs, yeah.
Yeah, no, that's right, James, I suppose. And if farms can have their allowance, keep an eye on their allowance, talk to their advisor, have their soil samples taken, complete a nutrient management plan, making sure that they're keeping within the rules, that they can spread what they're allowed. That's most important as well. We could add on that there too. That is the questions that I have there, and thanks very much, Seamus and James. Conor, I might go back to you there.
Sorry, John. Just
Sorry,
because we're just in abortion season, and if lads are bringing lambs abortions, if they can bring the placenta, the afterbirth, because if you gave me the choice, obviously I prefer to get both, but in yours, if you gave me the choice to have the afterbirth or the lamb, I'd actually prefer the afterbirth. So really important if you can bring both. Thanks.
That's very, very, very practical. And Seamus, like a container maybe to bring that in, what could people use? Something that's clean, maybe a clean bag or anything, would that do? Or
Yeah. Look, they come in everything from buckets to fertilizer bags, etc. It's not it's not a huge issue. Obviously, is keeping it clean, but they're often picked out of the ground in a shed and etc. And we can still work on them. So keeping them clean. It's more, I think James mentioned earlier, just to be aware yourself that some of these diseases have potential to affect the human themselves. So minding yourself, that to me is probably more important than thinking of protecting yourself from it, you know what I mean? So wrapping it properly that nobody is going to get infected or is not going to be left anywhere that people are going to, that's probably the more important thing than keeping it clean for us, if you want to call it.
Yeah, no, that's great. That's good advice, Seamus. That's a good tip now for the year. We get a lot of queries as advisors every year about abortion, what type of abortion it is, and it's an issue on farms, and it seems to be multiplying year on year. So it's a very insidious disease, and it seems to be wiping out some flocks actually in the area, from my experience dealing with farmers. So that's good advice, Seamus. Yeah, excellent.
Yeah, John, just on that, yeah, because often, especially with EAE, chlamydia, you'll have a couple the first year, and if you can identify it that year, you can but if you allow that one to grumble over and you haven't identified it this year, next year is when you'll see the explosive outbreak. So getting on top of it early, and I suppose, we talked about when you're in the middle of lambing, it's hard to, but often the abortions just happen a little before lads get real busy. So there probably have a bit more time to come to us at that stage, I suppose, what I'm saying.
Yes. And biosecurity is a big thing, and I suppose purchasing, the purchasing pattern and the policy that farms have as well. I suppose they're probably the biggest methods of transfer farm to farm. I suppose purchasing in cheap that have it, you know. So yeah, that's all, Connor. Questions here
Oh.
now for Seamus and James. Thanks, Seamus and James. They're answered very well.
Thanks, John. Yeah, look at just like to thank our two speakers, James and Seamus, and thank yourselves for participating with the questions and answers. And just like to close the webinar or whatever. And I suppose it'll be available to watch if you want to watch it again, or if colleagues or farmers haven't seen it, on the Teagasc Longford Roscommon YouTube channel. Okay, we leave it at that.